All right, we are live. This is lit. Hello, everybody. Hello. We're going to get going. I'll get started here soon. Give everybody a few minutes to get in. If you're able to show up, that's great. Yes. Yes. Thank you all for being here. Everybody had a great day. Give it a few more minutes, minute or two, until we get a few more people in. I want to thank those who are already in right now. I really, really appreciate it. This is my first live ever, LinkedIn, Instagram, but I'm super excited about telling you guys about my city, my health, and the conference that we have coming up in November 11th, 2022, here in Des Moines, Iowa. So a couple more seconds, we'll get everybody going. If you have any questions, comments, leave them. Hopefully I can answer them, and I'll answer them the best that I can. If you can't hear me, let me know that too. That'd be dope. My first live, so I don't want to mess this up. I don't want to mess this up. All right. Well, I won't keep you guys too long. It's 5:01. I'll get going. So today I just want to give you guys a little bit of information about my city, my health. I've spoken a little bit about it. Is this has been a process. This has been something that I've been planning and going over for man almost a year now, trying to figure this out. But before I tell you about my city, my health, the conference, I think it's really important to tell you about, well, one, why it started, how it began, where the idea came to have to organize a conference coming up this fall. So I think um, best thing to do is start with the Healthy Project. So hopefully a lot of you have listened or subscribed to the Healthy Project podcast. If you have, thank you so much. I appreciate that. But the Healthy Project started back in 2020 during kind of the thick of the pandemic. Podcasting was something I always thought was cool, just never thought I would do it, never had an idea to do it. But 2020 came and I was like, why not now? And funny story, the Healthy Project was Smart Talk, the Smart Talk podcast. Specific, measurable, attainable, realistic, and right on time health and wellness conversations. So if you go all the way back 2 years of some change, those first 10, 11 episodes were with just health coaches. I was speaking with health coaches or people who had some kind of coaching background, and we were just having some dope conversations. Nothing too crazy. But during that time, in talking about prevention, which was great, but during that time, a few things happened in my life that really changed the trajectory of the podcast. One, I had to change the name from Smart Talk to the Healthy Project because Smart Talk, for some reason, was confusing for people. They always thought it was a finance podcast, and it wasn't. And I was just tired of trying to explain it. So I changed to the Healthy Project. But around that time, um, my mom was diagnosed with breast cancer. And that was very hard for me to deal with because, she that's my mom, right? Well, during that process, I started to find out that, she wasn't being treated very well in Illinois, where we're from, and wherever her healthcare provider was there. And as that was going on, I started hearing more and more conversations from Black women on how they were treated in healthcare. Um, and I didn't think that was a coincidence. So my heart was already like, okay, um, you hear about racism in healthcare, you hear about these disparities in healthcare. Um, as a health coach for a federally qualified health center, I work with a lot of patients, um, and you see some things that you want to change, but it was never really on my radar until it was right in my face. And then I started to think, okay, I really want to have these conversations a lot more. And it wasn't just because of my mom. There were so many things that were happening that I felt like I couldn't just talk about what the best keto diet was to lose weight. It just wasn't. I just wasn't feeling it anymore. I needed to make a change. So that's when I decided to talk more about health disparities, health equity, prevention. You know, I'm a prevention guy, as a health coach. That's still there, and I still have some conversations outside of health equity and diversity. But that has been the sole kind of purpose of the podcast. Um, and we've had great success with that. We've ranked top 200 in the US in all of Apple Podcasts, ranked 182 in the medicine category, and just has some great guests on the podcast. It's been a total vibe, and I've been super excited about that. But why we're doing My City, My Health. So, about a year ago, I'm having a conversation with a friend of mine. Shout out to Larry Twitty. And I was just saying, what's the next move for the Healthy Project? I really enjoy doing the podcast, but I want to do more. What can I do? And he said, man, you know what you need. You need to do a conference. And I was like, that's a good idea. And I'm like, yeah, I think you're right. But that was just kind of where it stayed. And I didn't know what kind of conference I was going to do. I didn't know why I would do a conference and how it would benefit the city of Des Moines, Iowa. But a few things happened along the way to why we're having this specific discussion. Well, one, you know, I kept thinking about how my mother was treated and how other people are treated in healthcare and biases and things like that. And then I had a patient. Um, a patient came to my office and I was seeing her for a while. And one day she came to my office and she was just kind of off. She was always very talkative and very motivated to change. She was diabetic. But this one particular day, she was just not there and I felt it. And normally, you know, I just kind of leave it as is. Like people go through things in their life, it ain't my business. But I said, "Hey, how you doing?" As she was leaving, right before she's leaving, you know, I'm gonna say, how are you? How are you doing?" And she's like, "Well, I'm just really stressed out. My Because of the pandemic, my husband isn't working, and we're late on our. We don't know how we're going to pay our rent." And I used at the time I was using, it's called Aunt Bertha. And that was findhelp.org. It's a super great platform. So at the time I went on to Aunt Bertha, I typed in her zip code and I was able to find her organization, a community-based organization that helped with rent relief. And you could just see whew, just the weight lifted off of her back. Like that was that just totally changed everything. And I never followed up. I don't know how that helped or if that organization was able to help her with her rent. But what I can tell you is that that next session, thank you, brother. But that next session, it was a different person. She was back at it, and you can just tell that stress from that rent was no longer there, and that got me thinking. We have all these community-based organizations in Des Moines and all over the country, but I'm just talking specifically about Des Moines. That's where I'm at, right? They do so much to help us improve the health of our community in more ways than one. I can give you all the best health coaching I can, but there's no way I could have helped that patient if she's stressed about her rent. She don't give a damn about her diabetes when she don't know how she's going to make rent the next month. It's the least of her concern. So that made me think like, man, there's something to this. So I had my mom's situation and I had that. And just to give you an update, my mom is cancer free. She's doing well. And we're truly blessed for that. But the mom situation, other women that I spoke with, working within a safety net or federally qualified health center, and working with the people that I serve, black and brown, immigrant, underserved, and most vulnerable population. I'm helping that patient. It made me, it just, all these things were happening. And at that moment, I knew what I needed to do. And I knew what this conference needed to be about. And I started saying to myself, health is a community effort. And that is the slogan for this conference. And it is so true. And what this conference is going to be about, we have great speakers. If you want to go to mycity.health, you can see all the people that are involved. Um, there are 4 panels. We have a culture and healthcare panel where we will be talking about bias in healthcare, racism in healthcare, how culture plays a role in how people receive their care. Um, we have a mental health panel with some dope people involved. We have a prevention panel. It's during the month of November, so obviously we're gonna be talking about diabetes and other things, other parts of prevention. And then there's a community panel where we're talking about just what I told you, how community-based organizations and healthcare organizations partner for the betterment of our community and to improve the health of those people that we serve. And I'm super excited to have Renee Hardman be the keynote this year that Des Moines um, for that Des Moines conference. It is it is just going to be it's just going to be dope. What I've been It's value and vibes. That's what I can tell you. We're bringing value for the people that are in the audience. This audience, definitely a lot of health professionals. Please come learn from the panelists. Learn how you can improve your practice, and take something with you to where you work. And if you're not in healthcare, come rock with us. You have value too. You know, um, how your experience in healthcare can be valuable to someone in that audience who is in healthcare. So come see what we're talking about. Um, Add to the conversation, right? There's one thing that I've learned just going to health conferences, um, over the past couple years, pre-pandemic, is we talk a lot about health and how we can help people and how we can improve the health of others, but those people that we're trying to improve are not there to give their 2 cents. And I think that is very, very important. And that's just my opinion. That's just my 2 cents at a discount, tax free. But I feel like it's important to have people in the audience, that have a voice and want to say how they feel about something. And I tell you what, we have the speakers there that can give some great value to you. Um, what else is there that I want to say about this conference that I haven't already? It's at Mainframe Studios. Okay, sorry, Mainframe Studios, November 11th, from 9 a.m. to 3. We have a great guest again. We have great entertainment. We have some networking things we'll do there as well, just to vibe with everybody and learn and how we can improve the health of the city of Des Moines. And I'm super excited, and I'll get more into this as well. But after this, if you're not able to participate in the My City, My Health Des Moines, we are currently organizing My City, My Health Iowa City. So if you want to rock with that, you can. It'll be at the University of Iowa. Same topics, but we're adding diversity and research to that conference. And it's just that's going to be dope too. And it's going to be hybrid as well, virtual and in person. But if you can make it in person, you will not be disappointed. Again, go to mycity.health. You can sign up for the in person or virtual. You know what I mean? And it's going to be great. I can't. I don't know what to tell you. I don't tell you. I'm just excited. It's just going to be great. I just hope you can be there to witness it. November 11th. Um, I will be obviously speaking more about this throughout the next couple of months, as we get closer to that November 11th um, date, Black Panther Day. So it was meant to be. So again, everyone that's been rocking with me, Thank you so, so much. I really appreciate your time. Um, and this is, I'm doing this because it's for the people. Yes, the healthy project is some great things, but this is for the people and to improve health, and doing it the best way I know how I can. I can't hold everybody's hand. I can't help everybody, but what we can do is have a conversation about it that's really going to make a change. Not just, I don't want anybody to come to this conference, hear a great word from these people, uh, and then do nothing with it. That's just not what we're going for. We want to make a change here in the city of Des Moines. Um, and that's what we're going to do. Point blank, period. Again, everyone, it's been about what, 15, 16 minutes. I want to thank everybody who's been able to be on this live, my first live ever. I really appreciate you for rocking with me, and rocking with the podcast. If you haven't, the Healthy Project podcast. And again, thank you. I'll holler at you next time.